Hello, everyone. Dr. Christine Smith back for a really cool interview for you today, all about psychedelic therapy as the future of mental health. And I wanted to go ahead and invite on Dr. Will Derveer, who is the founder of the Integrative Institute for Psychiatry and is working on training other practitioners in how to facilitate these sessions areas of their life and really get to experience the magic of this with a little bit of guidance, almost akin to the idea of what we used to operate with shamanism in our cultures and having elders guide us and the wisdom of our community. So thank you so much for joining me, Dr. Vanderveer. How are you doing today?
Doing great. Great to be here.
Yeah,
Thanks for having me.
absolutely. Oh, my pleasure. I'm so glad you're here. I was just telling everybody a little bit about you, but I know that you have undertaken a lot of study yourself and then worked on founding these training programs. And I'd love if you could just share a little bit about your journey in this and what led you to falling in love with this niche of training practitioners on how to truly facilitate these sessions.
Thanks, Christine. Well, in a nutshell, so I'm a psychiatrist. I'm traditionally trained. I got out of training in the early 2000s. I started using the tools that I learned how to use, mostly medication and talk therapy. And within a couple of years, I had too many people just kind of going into holding patterns and they're on the merry-go-round of, let's try this medication and let's go off this one and go on this one. And many people were not getting well. And I was deeply disturbed by that. And I actually quit psychiatry for a period of time in despair, thinking that, oh, I'm going to go teach meditation or do something more holistic. And I started practicing meditation for hours a day, and it started to dawn on me over the months of that practice that I was the one who was the problem. I needed better tools. And in the beginning, I went on a tear of learning a lot of the things you and I offer to our patients, which is integrative medicine and looking at adrenal stress and gut brain health and environmental toxins and the whole nine yards with integrative medicine, functional medicine. But there was still something really missing for me, which was how to address trauma in an effective way. And so about almost 15 years ago, I got involved in an MDMA assisted therapy clinical trial. And I got to see with my own eyes people who had struggled for years under my care, semi ineffective care, do really well after 5 months of this protocol. And so that really just changed my whole outlook about what was possible in the healing process if we could integrate psychedelic healing into what we're doing with our patients.
I mean, it's such a unique tool, and I feel like it really helps to overcome some of the hurdles that I'm sure you encounter in some of your sessions of just where kind of the conscious mind or the part of us that tries to protect ourselves, something we might call the ego, tends to get in the
Mhm.
way of our own healing because we are so incongruent with a thought. So I'm curious, what have you seen unfold in practice as you've been using this as a treatment modality for any variety of conditions? And are there some conditions that respond better than others? But yeah, what have you seen unfold since you started this?
Well, to your point about the ego, I think it's a great place to start because, as a therapist, I was used to, before getting involved in this work, spending hours over the course of years, sometimes with people, trying to help them kind of pull the bricks up of the wall of their defense systems out of the way so we could actually see what was going on. It's incredibly um, frustrating for clients, and it takes a lot of patience as a practitioner. And so what we see with these treatments is that a person, it's almost like a helicopter comes down into the fortress of ego and pulls somebody up so they can look around and say, oh, wow, there's a whole landscape. There's a forest over there, and there are like fields with, beautiful animals over there, and there's a scary fire swamp over there, and there's all of these different places inside of ourselves that we can't even see when we're inside of the fortress of ego. And we all have this. And it's there to protect us from the scary things that are inside of us, which also hold the keys to our healing. So to get in touch with those things is so critical. So as far as um, what we've seen, so there are different tools right now that are a better fit for very specific conditions. So I'll just start with the top and say that I've learned that trauma underlies many of the different manifestations of what we call mental illness. So anxiety, depression, obsessive compulsive symptoms, even bipolar symptoms, insomnia. Um, when we get into a healing situation with a psychedelic medicine, oftentimes people can find these early experiences that they've um, either forgotten about or dismissed or felt like, oh yeah, my parents died in a car accident. That was no big deal. I survived and I moved on, like minimizing the impact. So we can go back and we can actually work with these things. So I just want to make that point first, that it seems like trauma is a big factor that can underlie things that I was taught as a psychiatrist have nothing to do with trauma, like depression or OCD or bipolar or so forth. So the tools, it seems like MDMA therapy is particularly well suited for working with PTSD. And we can talk more later about where we are in the process of the approval for that. It looks like psilocybin therapy, which is available already in Oregon, and there's other states like Colorado that are almost ready for that to happen, is really good for depression. Uh, Ketamine therapy, which is available in all 50 states already, is can be highly effective for depression and particularly suicidal thinking. So, and there are other tools that are coming down the pipeline that are more in the beginning stages that we could touch on later. But it's pretty exciting because we have a revolution that's happening in my chosen field, which really needs a huge revamp. So.
I am so excited for the things that are coming. I think there's a lot of potential and a lot of options. And I'm excited that the rest of these things are kind of moving their way through the system because I know there's a bit of a different process in psychedelic therapy from what people usually think of when we say therapy. And I think in that process, there is an evaluation of which one of these things might help in the best form for that particular case and that particular client, because each one really has its own effects and its own medicine. And I also think working with a trained facilitator and picking the right facilitator is one of the most important parts because to me, in my experience and my experience with clients, I think the ceremony and the intention beforehand and the integration before and after is probably the most important part of the entire experience. So I'd love if you could share a little bit from your perspective about how this process of psychedelic therapy differs from what people think of when we say therapy.
Such a great question, and it's so true. It's very different for ordinary therapy. And I think the first thing I want to say is that the the imperative of choosing carefully the guide that you work with is so much bigger because the vulnerability is so much higher with this kind of work. Um, when you're on a psychedelic in a session with a guide, you're very suggestible, and that means that the things that happen in that space, the things that the guide says, um, are have a much bigger impact than when this self-protection mechanism is online, like we were talking about earlier. So it's very tender, and so
I
the
think of it
training,
like you're almost in a bit of a programming state, like you're kind of
yes,
entering the
exactly,
programming part of the mind.
exactly. Exactly. So yeah, that's a great way to think about it is like the possibility of installing code that's bad code is very high. And so you need a really skillful person to hold the space. So the coding that you do is effective coding that makes the glitches go away in the program, right? So, so, and then the other piece that you mentioned that's so important is integration. People don't really um, if you're not familiar with this framework, then you might think that the psychedelic experience itself is what causes the healing to happen, and everything else is sort of like just window dressing around the big event of the psychedelic session. But in reality, the work that you do after the psychedelic session is where the real money is in terms of long lasting change. What we're trying to do is accomplish long lasting change, not just a magic trick of like a state change that it could be, something interesting to tell your friends about afterward, but may not actually cause, meaningful change in your life. So it takes time to change these things. I mean, maybe an example would be useful to illustrate the point. I remember a person we worked with in our MDMA study many years ago who, in the course of overcoming and integrating the traumatic memories, came to the awareness that their entire life was structured around avoidance of triggers of the PTSD. And so part of what was in front of this person in integration was moving back into the world. They had moved very far out of civilization and lived in a remote area in order to reduce the level of intensity that they felt from their PTSD. And so it was like, oh, wow, for me to get really well in the long run, I'm going to need to build a fabric of meaningful connection and relationship in my life. I'm going to need to probably move back toward where it's easier for me to be around other people and so on. So it's like there's a lot of work to do sometimes after the healing occurs. Otherwise, you're still in the context you were in.
Absolutely. And I think that's one of the benefits of doing something like this in comparison to maybe say just trying an antidepressant, which they absolutely have their place and they can really help a lot of people. But one of the differences I have found for clients who've gone through this is the difference of actually dealing with it and
Hmm.
actually facing it and moving through it and feeling it, but doing that with guidance in a way where you can almost leave the experience with a positive memory of that processing rather than just kind of talking about it in circles. Because I think one of the real benefits of the psychedelic realm is it gets us in touch with the feeling side of ourselves and takes that block of the ego out of it, where you're still trying to defend your story or justify yourself or feel validated. And when we can start to kind of back out, like you described, and have that third party perspective, it can make a huge difference in actually processing something. And when you go to do these sessions, you're booking out a huge chunk of time where you are unavailable to anybody in your life and you are completely focused on doing this thing. And it's a lot easier to process something when you book that time out. And you can do that sober on a retreat. You can do that if you are using antidepressants, but actually making time to process this. But I do think the magic of the psychedelic approach is that softening of the ego that allows you to be more curious in everything that you're exploring. And I wanted to bring that up because I know some people are like a little intimidated by the concept of trying something like this, and they've heard about the concepts of bad trips and whatnot. But I think that comes when you don't have that safe container and you aren't working with someone who is helping you to guide what you are reprogramming. And I've had some very powerful experiences that have helped me in ways that, even like I love my subconscious reprogramming tools. I've used them in a variety of modalities, but sometimes there's just certain things that are stuck that you need a little extra assistance moving through, and then you can continue to apply your other tools around it. But for anyone who might be intimidated by this concept and feel there's risks, which there are with any medication, what would you tell them to consider when they're determining if it's the right approach for them?
It's a great question. So back to the beginning of what you said about SSRIs or antidepressants, we are um, when I'm prescribing as a psychiatrist an SSRI, I'm prescribing a what I think of as a suppressive treatment. So the purpose of the medicine is to suppress emotion. Um,
Mm-hmm.
and it's a somewhat blunt tool. So it suppresses all emotion typically to a greater or lesser degree. So people will have suppression of what we call positive emotion and also suppression of negative emotion. And we are, in general, I think we're a suppressive culture. We operate on the idea that life is a little bit too intense. We like to say when someone asks, "How are you?" "I'm fine," right? Well, what does that even mean, right? It's interesting when I've visited other cultures and someone asks how you're doing, or you ask them how they're doing, and they actually give you an answer that it's like there's a nuance to that question. Um, so people who are used to that kind of treatment, who then are looking at psychedelic therapy, need to understand that there's a huge difference between a suppressive approach Um, and as you pointed out, it's helpful sometimes to suppress feelings. If people are having panic attacks all the time, suppressing that to the point where they can do therapy or get, on with their life, it can be extremely helpful. So nothing wrong with that. But the problem is that once you stop suppressing, where are you at? Well, you're still with the intensity that's under the surface. And so psychedelic therapy, I will say, you are signing up for what we call an evocative therapy. So these tools are known as non-specific amplifiers because they amplify what's already in you. If you have a big boogeyman or skeleton in the closet kind of thing inside of you, it's going to get amplified on the psychedelic, and that can be extremely scary, especially if you are not prepared for that and you're not um, willing, you're not a yes on some level to embracing whatever lives inside of you. Um, one of the things I'm most excited about is this um, possibility that people can embrace when they embrace a more evocative therapy of stepping into more psychological flexibility. And we know from the imaging studies, functional MRI and SPECT scans and so forth, that people move into a more flexible state, which is what you were talking about a few minutes ago. And it's so important, if you think about it, to have a flexible capacity to meet the challenges of life. Life is always throwing us curveballs. There's all kinds of new challenges. 21st century election year, all the things that are going down with the environment. There's so many things happening. And if we have an inflexible mind, we could get flipped upside down by the smallest trigger of a headline in an article that we see or something like that. If we have a flexible psychology, we can look at that triggering article and say, wow, that's really scary. And, where can I go get a little bit of contact or resource to help me hold what's happening right now in the world? So anyway, I think that this possibility of, on a grander scale, offering a shift in the culture to, can we all become more psychologically flexible together? Can we learn how to have more difficult conversations with each other? Can we engage in meaningful, respectful debate with people who have different views and so forth and so on? It's so critical, I think, for the health of our system.
Absolutely. And I'm thinking back to even some of my own like experiences that I've had, and you really do get that backing out view that you're describing. Or one of the ways that I'll talk to people about it is it's kind of like taking an elevator up to where you want to go, having this epiphany of what it can be like and what those feelings feel like. And then it closes and you come back down, and then it's your job to learn how to take the stairs. And that's stuff like meditation. But at least you've been shown a map of how things can feel. And sometimes some of the feelings that might come up is like, everything's already okay. And everything's just a part of the natural order. And like I am I am loved, right? And it's like those can just be some of those small little moments that end up coloring the entire experience. And it's very interesting because sometimes what you think is holding the charge for you isn't actually what's holding the charge. It's something else and something older. And then it's like all of a sudden you have this kind of ball of trauma with all these little threads sticking out. And every time a thread gets pulled on, the whole ball gets pulled on, and you think it's the thread, but actually it's like it's this core thing that we need to address. And if that core feeling of like, I am already okay can be addressed, then all of a sudden all those little charged threads suddenly lose their charge. So in all of this, I think, one of the things that comes up for people is they don't really know what it entails. Would you be willing to just share with people a little bit of like the process from intake to the completion of their integration series and like just what that might look like?
Sure, absolutely. So it varies slightly from one medicine to another because the ways that they are used is a little bit different. But in general, what happens is you would start the process by having an intake appointment with a therapist or with possibly someone like me, a psychiatrist, who would make sure that that this would be a good fit for you. There are certain things medically and also psychologically um, that could put you in a higher risk category for using these tools. And there are ways, as you pointed out, with meditation retreats, breathing practices, and so on, that you can enter a psychedelic state without taking a psychedelic medicine. So it's important to mention that. And then after the intake and making sure that you understand as well as possible, what you're getting into. It's a little hard to describe in words what it's going to feel like. Then you should have a number of preparatory sessions to get ready and better understand what you're going after, what you're trying to address in the sessions coming up. And then you may have one or two or three sessions. In the case of ketamine, you might have 6 sessions of ketamine. We've kind of already addressed this, but I think it's always important to say being in a safe, quiet, controlled setting with a skillful guide is way more likely to produce beneficial therapeutic results than doing this at home or doing it in a random place or at a concert or something like that, where things can get intense and out of control. And you might have an experience of some traumatic material coming up and you've got no one to help you with that. And unfortunately, we've seen, a lot of cases of that in our clinic. So we really want to emphasize finding the right person to do this work with. And then after your medicine sessions, at least 2 or 3 or even more integration sessions without medicine to break down what you learned. In the example you described of I am love and everything's already okay, how are you going to make that be an everyday experience in your life? Taking the stairs, as you said, like to that elevated state of joy and consciousness and integration in your world. So there's plenty of work to do there. So that's the general sort of trajectory.
Thank you. Yeah, that's really helpful just because I think sometimes it's so kind of obscure that I think just giving people a little bit of tangibility to it and how simple it can be, and that really you can make massive transformations in like 3 sessions, just makes it something for people to be curious about. And if you're open to sharing, what are 1 or 2 of like the greatest transformations that you've gotten to see, or just kind of your favorite ones?
Yeah. Well, I had one person I worked with for many years who uh, ended up being able to come into the study that we did a few years ago. And he had been just getting routine care from me as a psychiatrist, um, you know, therapy, medication, struggling intensely for many years, like over 10 years of care. And uh, when he came into the study and I was his therapist on MDMA therapy, he took the medicine and looked in my eyes and he said, well, bless your heart, you tried hard. You did everything you knew how to do. Nothing helped me. This is helping me. And went on to put his trauma behind him and move on with his life. So that was an incredibly powerful moment for me. It's hard to describe what it's like to provide sort of mediocre results to people for that long, and then in such a short period of time see so much change for a person. So it's incredibly exciting as a practitioner to have better tools. Um, I could share an experience I've had
Sure.
in my past. So when I decided to offer ketamine assisted therapy, I signed up for a training, and in the training they were giving us high dose ketamine, intramuscular ketamine. And I didn't know at the time really much of anything about ketamine. I knew a little bit about it as a doctor, but I didn't realize that the doses that were being given to me 2 days in a row were pretty high. And it was at a time in my life, and I'm offering this to illustrate the point that when you go through psychedelic therapy, what's going on in your life matters. So this was 7 or 8 years ago, where I was going through a divorce. I was in a very tender place already, and of course, I underestimated how tender that place was because I'm kind of arrogant that way, you might say, and I can handle this. This is no big deal. And so I went into this training, and by the end of the second ketamine dosing session, I felt really weird in my body. I felt kind of disconnected from who I was. I had a really hard journey where I didn't know who I was or what I was or where I was or when it was. Very disorienting. And I was headed to a professional conference directly from the training, which is another form of my arrogance manifesting. Like, I don't need any integration. Here I am talking with you about integration. I made no time for integration. So I got on a plane. I still felt really weird. And we landed in California. And I was in the back of an Uber on my way to the conference center. And I was having this thought, I wonder what would happen if I jumped out of this Uber at 55 miles an hour. And I'd never had a thought like that before. And it was pretty scary. Luckily, I had one friend on either side of me, so I was in the middle of the car. I don't know if I would have done it, but it was just really scary to be having that thought. And the conference I went to was a psychedelic medicine conference. So I opened up to a handful of people about what I was experiencing and how it came about. And it was good luck that I was at a psychedelic conference because there were plenty of people there who said, "Oh yeah, I went through a really difficult journey, and it took me a month to come back to feeling normal." Or one person said, "Yeah, I went to Peru and I took some medicine, and I was gone for a year." And I was like, "I hope that doesn't happen to me." But in any case, there were people who could relate to what I was going through, and through the use of my own psychotherapy with my therapist and acupuncture, meditation, cleaning up my diet, avoiding alcohol, all the things, basic things. Within a week or two, I came back into myself and I felt pretty normal by the end of that time. But that is a really intense thing to go through. And people do go through that, even when they're well prepared. But it's unusual. It's rare for people to have that hard of an experience. But I look back on that and I'm grateful for it because what was going on was there was a reorganization at the fundamental core of my being about how I felt about myself and what I thought was possible for my life. And moving out of this relationship that I had needed to leave for years, that I hadn't been able to find the courage to leave, came online after that. So anyway, it was a happy ending to a difficult, challenging experience. But we like to say in the work that there are no bad trips per se, there are difficult trips, and difficult trips require more integration. But the difficult trips most often tend to reorganize our being at a more fundamental level, where the result is more possibility in our lives.
I love that you said it that way. I think that's a very good way to put it. And people have very different experiences. And I know, like, I'll share a little bit about my own. So the first time that I was, kind of introduced to this realm was actually in the Amazon in Peru. And we were working with a shaman who, had been training since she was 9. She'd never left her village. And all I'd been told about, Aya and everything is that you have these like profound, like you meet your demons or you meet God or you meet both. So I kind of had these expectations. And when I went, mine was super gentle. I knew exactly
Mhm.
where I was. It was kind of like an intrinsic meditation on just being grateful for where I was in my life and all the people that had helped get me there. And I kept waiting and waiting for this like blast off that they told me would happen. And I kept trying to come back to my body, trying to come back to my body. And finally, after hours, I gave up and I just let my mind wander. And it turned into this very beautiful experience. And then out of those experiences, I got, like one of my intentions was to let the experience be what it is. And that carried me through the next leg of my trip where pretty much everything went wrong and nothing went correctly. And it gave me this core rooted belief and intention to hold on to that ended up coloring the next leg of my experience. And then I had also gone through a ketamine series after a mold exposure, and I like that mold kicked my butt. I have never been so depressed and so taken out of myself in my whole life. And I was allergic to everything. And the ketamine's interesting because it's also anti-inflammatory.
Right.
So in that process, it got the inflammation in my body down enough that I could actually meditate again. And I took
Awesome.
time off of work during that time for the integration. I think that was one of the most important things I did was just giving myself completely sober days, like alone, to just kind of process what was going on and working with the counselors that I had been set up with who were amazing. Like integration counselors are special people and they tend to be a little bit more trained, which I think we'll touch on in just a moment. But even like outside of that experience, there's one other, and each one's different, right? And those experiences, they kind of just let you be in your own experience, and then you talk about it before and afterwards. But during it, you're like very in your own world. And then one other one that I had done was more guided, and someone was with me the entire time, and they were talking to me the whole time and helping me redirect my thoughts and redirect my mind and asking questions. And we did this exercise where she basically took me through and like had me close my eyes and just imagine like if you had lived this life that you thought you were going to live, I want you to tell me about it like you're on your deathbed telling me about your life. And my mind was flexible enough, as we've been talking about, to allow my subconscious to just answer. And so she'd ask me questions like, did you stay? Did you have a family? Did you have children? What were they like? What did you tell them? And I was able to get all of this experience and advice and basically live this whole lifetime inside of my own mind through her questions. And when we finished it, that charged ball all of a sudden unraveled. And all the little tendrils that had charge just no longer had charge because I'd gotten to live out this thing that I was grieving and see it to completion. Even though it was, in my own imagination, I now have this place to put all those feelings that's a positive association that I can visit happily and feel like it completed. So even though I know that wasn't something that happened, right, it was this mental process that my system got to go through to have it work out okay and release the charge of everything. So I'm just sharing these because I want people to know like how different these experiences can be for everybody and that it really matters the facilitator that you have and how they're guiding the session. And even like in the Amazon and stuff, those shamans, they sing what are called ikaros, and they're basically songs that are meant to guide the whole experience. And so even if someone's not talking to you and you're in your own space, having someone hold that container for you is kind of the concept of like an isumatek, which is basically like this sacred space holder where internal wisdom is revealed. And that energetic safety that's provided by having another human unconditionally accept you in your moments of transformation, I think is healing by itself. But I know, like, we talked about how integration is one of the most important parts of any psychedelic endeavor, but it does require like a knowledgeable approach. What is the additional training responsibility for practitioners who might be considering guiding this to do it really well for their clients? Or what could clients look for in a practitioner?
That's a great question. I will use myself as an example. When I first started working with psychedelic therapy, I brought to the table what a lot of um, practitioners would bring to the table. So being talk therapist means you're used to talking a lot in a session. And not only that, you're used to having the right thing to say at the right moment. And, as a therapist, it gives you a little boost to your ego to be an important part of the person's healing journey, right? So, and, there's nothing wrong with that. But when you go into psychedelic therapy, one of the things I had to unlearn was talking way too much. And also, there's an important, very empowering difference about psychedelic therapy that you just alluded to, where you as the client are doing the healing. You are tapping into um, a divine or wise part of yourself. Um, you don't have to think of it as divine if that's not your framework, but there's a wisdom that you can access in yourself, like your guide invited you to do, to look at the story of your life, and you're speaking to this unconscious wise part of yourself in that moment. And so, one of the big missed opportunities when you're working with a person who isn't trained specifically in psychedelic therapy is they may do what I did or would approach the work the way I used to in the beginning when I was a noob, by talking too much and thinking that you're the source of the wisdom that the person needs in front of you. You're not the source of the wisdom in front of no, you never were. But we're taught as conventional therapists to think that way. So the other thing that's different and why people need specialized training is that most of us who have never taken a psychedelic journey before don't know how intense the inner landscape can be when we explore it. And so when our client is beginning to explore intense areas of their inner landscape, and we don't know anything except the fortress of ego that we were talking about at the beginning, we're going to, as a practitioner, we're going to get freaked out, and we might start to do things or say things to sort of subtly guide the person away from their lived experience. And the opposite of what they actually need is to be cheered on, supported, to go right into it. And so this is something that doesn't come easily to us unless we have done the work on ourselves. We've looked at our own shadow, we've explored our own trauma. Um, it's kind of surprising that in conventional therapy, and this is even worse for psychiatrists like me, we're not required to go look at ourselves to become a practitioner. But in psychedelic therapy, it's imperative. We have to know the territory, at least to some degree.
I think that is a very wise comment and kind of leads into why you've turned to teaching all of these other facilitators so that they can do this in a way that's truly highly productive. So, if people were interested in pursuing this and they wanted to work with a safely trained facilitator, like what is available right now? What's coming up and where might they find it?
Yeah, thanks for asking. So, of course, I'm biased, but we run a program that I think is the best of what's available right now. So it's a year-long training. We start new cohorts twice a year. Our next one kicks off at the end of July. It's open to licensed therapists and licensed mental health practitioners, so nurse practitioners, physicians. And you can find out more about it by going to our website, which is psychiatryinstitute.com. If you'd like to apply to the program, psychiatryinstitute.com/apply. We'd love to hear from you. So those are trainings, as I said, for licensed individuals. If you are um, not licensed as a therapist, but you're interested in being trained as a guide, there are organizations that provide trainings for people who, and those can be great too. But we're focused on the licensed folks at this point in time.
Sure. For clients who might be seeking these services, do you have a database of practitioners that have gone
Yes,
through your training?
yes. So you can go to the drop-down menu at the top of our homepage of our website, again, psychiatryinstitute.com, and you'll see a menu at the top where you can click to find the provider directory. And we've trained about 2,000 people around the world at this point. So there are a lot of people in the directory. And I think almost, if not every state, almost every state at this point. So it's a good place to go.
Perfect. And for
Yeah.
anyone where you want to start to explore this and understand it more, but you're just curious, you're not quite ready to dive in, Dr. Vanderveer has a fantastic podcast called Higher Practice that I really recommend checking out. And they discuss everything from, these concepts specifically around the medicine to just more open-minded, bigger idea concepts about society and emotions and how we process our trauma and how to work with ourselves. So it's a really beautiful podcast. I highly recommend it. And to anyone who just wants to learn more, like feel free to message us or comment on
Right.
this video after it's posted and we'll answer you. That's why we do these. Like we just want you to know what's out there. And there are so many movements happening for making this available to people. And I truly love it because I think when you're trying to really move forward in your life and really feel differently, actually facing the thing that you can't seem to uncover by yourself is going to be the most effective way of doing that rather than just numbing it out and living your continual autopilot life without ever actually diving into it. So I think this is a really big opportunity for our society as a whole to heal those old deep wounds that sometimes we have buried so deep we don't even know that they're there, but they are affecting us. And for some reason, we're unhappy in our life. So, like, if you're unhappy and you're anxious and you're injured or you're getting sick, like, just know that, like, the stress that can come from old trauma can actually make your immune system not work as effectively. And then you can end up dealing with chronic illness, and they can absolutely be tied to emotions. And we didn't even really dive into some of the physiology that goes on beyond behind all of this, but like I'll just quickly say, like if you're on a medication long term, that permanently changes the microbiome of your gut and how you produce your own neurotransmitters. And if you take an antibiotic, even though it can be life-saving, it can actually basically delete out pieces of your personality because you just killed off a bunch of your microbiome that produces the neurotransmitters that make you who you are. So if you've gone through these experiences and you're just not feeling like yourself, you're not feeling vivacious in your life, and you're wondering where your zest for life went, it might be something worth researching and just talking to people, listening to things about it, and just knowing that it exists and that it's becoming available these days with a healthy, structured, safe support system, which I think is the most important part as we were discussing. So, in all this, if people, I think you kind of mentioned where practitioners could learn more about you, feel free to just repeat that for anybody listening. But if there is just something you wanted to kind of wrap this up with that you wished people knew, whether it was something you wished practitioners knew or something that you wish society could get in touch with that maybe have come from your own epiphanies and realizations of all the experiences
Mm.
that you've had, what would you want to leave people with?
Well, I think that the biggest message, um, the most important message I can convey is to have hope that there is a possibility for healing that's way deeper than you ever imagined. I have been beating the drum since I finished medical school that anyone can heal with the right supports and the right practices in place. And I believe that now more than ever with the advent of psychedelic therapy, practiced the right way. So if you're out there and you're really struggling, you might even have suicidal thoughts, you might be feeling very hopeless, please know that there are resources available for you. There are ways to get well. And it's not to say it's easy. It's hard work, healing. But these tools are a game changer in mental health care.
Beautiful. Thank you. Yes, trauma does not always feel great, but as they say, you need to feel to heal. So thank you very much for taking the time to do this today. And for anyone listening, reach out with any questions. And if you're curious and you want to know more, comment below, and we can always do another one on more advanced topics. And we just want to be here for you. So thank you so much, Dr. Vanderveer. It was such a pleasure speaking to you, and hopefully we'll get to chat again soon.
I look forward to it. Thanks, Christine. It's been great
Yeah,
being with you. Take care.
bye.
Bye.